And we're back. I'm trying to eat my apple, Dr. Whaley.
Go right ahead. I'll take. You can eat it while I'm talking.
Okay, yeah, that's what I'm gonna do. And we're back. We're back, and I'm your host, BKP. Beautiful downtown Blue Ridge, Friday morning. You know, the temperature's nice. It's been hot in the afternoons, hasn't it, Dr. Whaley?
Beautiful this time of day.
It is.
This is the time of day you're supposed to run. I used to do 8 miles, 40 miles a week for 40 years. This is the time of day I ran, not 4 o'clock in the afternoon.
Did I ask you about running?
No, but I was trying to help you with that apple a day keeps the doctor away.
Oh, you were trying to give me the rest of that.
Yeah, the rest of the recipes, 30 minutes of running, not necessarily 8 miles. Go ahead.
Dr. Whaley, thank you for being here. And we want to thank Georgia Cancer Specialist for this segment. I want to thank you for those hoot owls, because at 6 o'clock in the morning, I always look over and say, who put those there? Every week.
I did, yeah.
I said, who put those hoot owls there? Like,
yeah, well, I put
one of
those
these days I'll catch on.
They were at our house in Atlanta, and they came. They're old, as you can tell. They're about half rusted, but they're beautiful, aren't they?
We have a lot.
We do.
And let's start here, because I was thinking driving up, you would be able to give us some information, and Senator John McCain from Arizona, I can't even pronounce the cancer, but it's a brain cancer diagnosed this week, and you said you wanted to talk about that this morning. Can we start there?
We can. I just want to say one thing. You were talking about the drug abuse and the kids the kids in foster care. I was on the board of the Department of Corrections for a long time. Georgia had the second largest prison population in the United States, had more people in prison than many countries. And 82% of the people that we have in Georgia prisons, when I was on the Board of Corrections, were there as the result of something that had to do with drugs or alcohol. Now, not the substance abuse itself, but robbery to support a habit or to buy drugs under the influence of alcohol or drugs when they shot their wife or something of that sort. So alcohol and drugs just about is responsible for most of the stuff in prison. The guy who's stealing money from the pension fund and that sort of stuff isn't generally there because of alcohol and drugs, but just about everything else is. We'll go to John McCain in a minute. John McCain was shot down on October the 26th, 1967. I was in Vietnam on October 26, 1967, when he was shot down. I was the medical officer to the commander of Scoria Squadron 4, which was in charge of all naval gunfire support in Vietnam. And Captain or Commodore Dale Schimmerhorn was my very close friend. His son's even my friend today, 50 years later. And he was involved in some of the secret messaging about McCain being shot down. You remember McCain's father was Admiral McCain and was the commanding admiral for the Vietnam area. My wife doesn't believe it, but we know it to be true. He was offered the opportunity to be released as a public relations gesture on behalf of the North Vietnamese, and he turned them down. Now, anything else people want to say about McCain, I think the guy's a hero. I think that he's committed to his country, and yet don't have to agree with anything he did, because the next person I'm going to talk about is Ted Kennedy. John McCain has a high-grade glioblastoma called astrocytoma, and I have a particular interest and a particular expertise in that tumor, and 30 or 35 years ago was the only person that I know of in Georgia doing aggressive chemoradiation therapy for that diagnosis, and that today is the preferred treatment rather than surgery. You will remember that a very famous and very wealthy guy named Ted Kennedy got a high-grade glioblastoma, exactly the same tumor. He went to Duke for treatment, where two very fine men with great treatment programs are there, and he was dead in 12 months. He was able to get back to the floor of the Senate to cast a deciding vote in a Medicare battle, and he actually came in, as I recall, in a wheelchair and stood up on crutches to cast the vote. And he was at the inauguration of President Obama. He had supported Obama against Hillary Clinton, done lots of unpopular things, but he died within 12 months of the time his tumor was diagnosed. And everybody has to think Ted Kennedy would have gotten the best treatment that's available. So when people are talking about John McCain's going to fight this thing and he'll be fine, the truth of the matter is the average survival of astrocytoma of the type he has prior to the most aggressive treatments that he is getting now has been about 6 months. With a surgical debulking, which was the treatment before we had the chemotherapy and radiation, you could double that to 1 year. And the treatment now with kind of gamma knife radiation, the use of the drug Timidar, which is a pill they mentioned he would be taking to make the radiation more sensitive. The average survival is about 18 months, and the good survivals are 2 years. By the time the patient gets to about 12 months, they begin to have intellectual deterioration, change in personalities, seizures, headaches, may have paralysis, not be able to walk. So that I would say that in realistic terms, John McCain's useful life in the Senate is going to be very short. He'll probably have 3 months of aggressive treatment, be about 6 or 7 weeks of radiation. He could easily get treated in the morning, fly to Washington and vote, go back in the afternoon, or he could even get radiation in Washington. But within 12 months or so, he will be unable to serve in the Senate, and within 24 months, he will be an invalid, or he will not survive. And you haven't heard that on
no, actually, I'm thinking
got,
as you said that you know, Sam always puts the segment up later in the show, and that we need to highlight on the headline there that, you know, Dr. William Whaley gives a realistic diagnosis.
Realistic expectation.
Yeah,
now,
yes.
Now, my wife asked me, do you have anybody that doesn't fit that? I said, yes, I do. I've got patients that are in their 25th year after that aggressive treatment that we gave before. But when you're asking me whether it's likely Georgia Tech's going to win the national championship, I'm going to tell you no. And then if you ask me, is there a situation where Georgia Tech could win the national football championship, I'd say yes.
So, yes.
So the number of people who are going to live beyond 2 or 3 years is in the 3, 4, 5, 7% range, not in the 50%
I'm going to use
range.
the word realistically. You said 3 months, maybe top 6, but about 3 months that he could really be effective in the Senate, or
it could be a year.
But it's
not going to be forever. Yeah,
within the year.
Within a year.
Okay. All right.
I have a patient that's a very, very, very well-known figure in the South that continued to run. He's still being treated. He's not able to do this now. But he ran a huge business and did so satisfactorily for about 14, 15 months. But he also had a great big staff, you know, and he had people he trusted, and he was making a lot of decisions in the first 10 or 12 months, and became more and more of a figurehead in the next 6 months. That help?
Yes.
Now you'll get to the questions, huh?
Well,
we could spend all day if you wanted to.
Well, I want this one because I particularly am very interested in this one. Does inversion therapy relieve back pain? Is inversion therapy safe? And that's the hang upside down.
Okay, now
contraptions.
The question you asked is it safe? Safe.
Yes.
Why don't you first ask if it does any good?
Okay. All right. Let me go at this a whole different direction. Does inversion therapy does it do any good?
Okay. The answer to that question is no.
No.
And then the second question about its safety is a little bit more complicated. But I was going to say we could spend hours just on chronic low back pain. And in an effort to make this as user-friendly as I can, 84% of adults will have an episode of back pain in their life that interferes sufficiently with activity to keep them not where they won't be able to work, or they won't be able to function, housewife, or whatever it is that they do. So everybody that's listening here today, you might as well sit down and put your cup of coffee and listen a few minutes, because that number of 84 to 90% that includes everybody. About 80% or so of that group of people, first of all, excuse me, let me stop right there. Once you get that acute episode of back pain when it's lasted 24 hours and 48 hours, you've got to go see your doctor. Assuming that you see a Ray Tidman or somebody like that who knows what they're doing, they are going to characterize this back pain as being a radiculopathy, meaning that you've got a nerve that's compressed, that's like a disc. That's an acute back pain. That's not what we're going to be talking about today. Or that it represents something like a malignancy in the back, or it represents an infection in the back, and that it is an acute episode of pain related to some significant other problem. So we're going to talk today about the largest portion of these 84% of people with the bad back, and that is the chronic or non-acute back pain. If the patient stays mobile, takes a non-steroidal for pain, does not do anything else, no chiropractic, no massage, no nothing, about 80% of those patients are going to be back at work and the thing's going to be over with in 30 days. If this pain lasts longer than 30 days, then they meet the criteria for chronic low back pain. And chronic low back pain, the biggest issue for the healthcare profession is not to do whatever can be done to help pain, increased function, and reduce disability. It's one of the largest contributors to healthcare costs in the nation and to employment costs, because once somebody's pain lasts 30 days or longer, if they don't like their job, if they are depressed, if they're not getting along with their wife, or any of a bunch of psychosocial mental things, they can get on that pathway to total disability. And then they become a burden on the healthcare system and a burden on the welfare system, and there's just millions of them. So what you really are trying to accomplish in that period of people when they get to 30 days is, what do I do to get them back to work with the minimum amount of pain? And there are tremendous studies. I got 10 pages here of the official recommendations of, quote, science. But things like massage, chiropractic, take to a hard surface bed, narcotic pain medications, all of those things, when compared to stay up, stay active, relieve your pain with non-steroidal anti-inflammatories, are not any more effective than that conservative approach. So first I'm going to read one paragraph, because it'll touch on traction, which is what inversion therapy is. We suggest not using the following modalities for low back pain: interferential therapy, that's a sort of psychotherapy; low-level laser therapy; short-wave diathermy, that's heat; traction, that's inversion therapy; electrical nerve stimulation, that's the TENS units you see advertised by Shaquille O'Neal on television; ultrasound, that's the heat thing they rub back and forth; percutaneous nerve stimulation, that's sticking needles in your back. Suggest not using them. For patients with subacute or chronic back pain, they suggest non-steroidal anti-inflammatories. Tylenol is no better than placebo, and narcotics are no better than non-steroidal anti-inflammatories. Now, up until the last 10 years, when patients had acute low back pain, they were very rarely given any narcotics. It was about 8%. And in this opioid epidemic we're talking about today, people with chronic low back pain, 30% or higher are given narcotics. Well, science hasn't changed that much in the 10 years. The marketing of the narcotics has. So we've just come right back to the narcotic epidemic that we were talking about here a week or two ago. Now, the other thing that we used to tell people, and I did this for 30 years, because there's a book called The Back Book that was written in the 60s or 70s that every orthopedist and doctor used to get free from companies that made non-steroidal anti-inflammatories, that showed you back exercises and core strengthening exercises and how to bend and pick up heavy packages instead of bending over like this. It's a very good book. But one of the suggestions that people had in those days was take your mattress off the bed and put it on the floor so that you're on a hard surface. Or get a piece of 3/4 inch plywood and put it between the mattress and the box springs for the rest of your life. Sleep on a hard surface. Well, that advice was never put to clinical trial. And when it was put to clinical trial, meaning that when you came in to get treated, you know, they flipped a coin. Half of you get the waterbed and half of you get the bedboard. It turned out that the hard mattress or that stuff was lousy advice and the patients didn't do well. So let me read you another one. Randomized clinical trials comparing back conforming mattresses, waterbeds, and foam with firm mattresses suggests less pain, improved sleep for conforming mattresses with a high dropout rate, meaning people quit the clinical trial, for patients assigned to firm mattresses. So we've blown a few kind of common misconceptions about back pain. One, that the narcotics relieving the pain are going to help your back naturally get better. Two, put your mattress on the floor. That's not going to do you any good. And three, that inactivity in any way improves your survival. So let's go back now to inversion therapy. Traction has been shown to be of no help. Most traction was given by placing a sort of a girdle around the chest, your arms go through it, and then the weight pulled you up.
Right.
So that your weight was pulling against your pelvis lying down. In a chiropractic office frequently, it was done by stretching you in a long direction. And years ago, I used to have a tilt table, and I had those things that you like around your ankles where you got to chin up and then put your ankles around it. You would probably have difficulty doing that, but the tilt table would work. And that is actually dangerous, because when you go down in that posture, unless you are doing it under the supervision of a physical therapist who wouldn't do it to you in the first place because they know it doesn't work, the blood rushes to your head, it raises your blood pressure, and if you have any tendency, either small aneurysm or you already have high blood pressure or what else, it can increase the incidence of intracerebral hemorrhage or stroke. So there is no documented medical group, American College of Neurology, Neurosurgery, Orthopedics, or anything else that puts their label of approval on the inversion bed or in the inversion boot or any other form of inversion traction therapy. I know the American Arthritis Association certified or at least sponsored, I forgot, Australian Dream or one of those rub-on creams one time. And they got a whole bunch of money for it, and it didn't work, and then they got a bunch of criticism and they stopped doing it. So nobody is, no good groups out there selling inversion beds.
Okay. Well, I'm not saying we're short on time, but
no, we're not.
I actually.
Sam's left. If she's left, then we can't be short on time. Where'd Sam go?
When I get the questions throughout the week, when I first look at them, I think, wait a minute, and then as I focus in, I think, hey, I like. Here's one. We are a nation now of going out to eat. For a lot of us, and I often bring home, this is a question, I often bring home food from a restaurant. Is it okay to leave it in the takeout containers in the refrigerator? What do you think about that? Because, at first I thought, well, I think that's a pretty good question.
I think it's a great question, because once again, you have to, like my wife says, ask Dr. Whaley the time and he'll tell you how to build a watch. But you like that, Sam? Okay. All packaging materials that are utilized in the United States have gone through extensive testing and are deemed to be safe. You will hear the same people that tell you not to get immunized because it causes autism, or all the other things I talk about all the time. So glad my wife is not here. But they'll tell you, oh, this is polystyrene and styrofoam, and the styrene leaches out and it gets in your body and all that sort of stuff. Basically the answer to the question is yes, it's safe to leave it in the container. And if you get when you get ready to eat it, if it's a cold thing and you put it in the refrigerator, you eat it cold and you eat it out of the container. If you're going to have to microwave it or heat it up, get it out of the container generally, unless it's got microwave safe on it, which some of them actually do from some of the higher end restaurants here in Blue Ridge, like that one right over there on the corner.
So just for safety's sake, if you're reheating it, put it in something at the house.
Else. Yeah. Yes. Okay. I want to go back then to the styrofoam, because they outlawed styrofoam in New York City, and I think it's outlawed in the whole state of California. The several dangers. One, we talk about people who drink energy drinks, like Sam, who's got one sitting on the counter over there, and adolescents and young people who buy coffee at these places and they pay $1 for it. I mean, can you imagine? I've never bought a cup of coffee that costs more than a dime. So what happens, those people tend to chew on the cup. And so you can see, you can just put your mind to it, and you'll see these teenagers and adolescents chewing on the cup, drink it, then they'll put something else in it, chew on the cup, drink with it. You know what a bezoar is? That's that hairball that occurs in the stomach of cats most commonly, or other animals who lick their fur. But humans get bezoars if they have eat a whole bunch of fiber or stuff, and that chewing on the box, if it happens to have fiber in it, can lead to bezoars, and usually kids between the ages of 10 and about 14 or 16 who are chewing on a takeout container. So that you don't want to chew on the takeout container. Second, styrofoam is polystyrene, and styrene does slowly leach out of polystyrene. Everybody says, oh my God, that's awful. Well, the amount of styrene that the average person gets in a day is 6 micrograms, and the approved amount of styrene per day for you to ingest is 90,000 micrograms. 6 is what you get, and 90,000 is approved. Now, why would there be an approved amount of styrene if people are worried about styrofoam? Well, the answer is styrene's a food additive at the dadgum factory where they make cookies and they make peanut butter and stuff. So people are worried about the styrene leaching out of their styrofoam cup when they've got coffee in it, when at the end of the day the styrene they're eating right there with a cookie in it, because it's a food additive. So that's another one of those alarmist things that people talk about that's got no basis in science. So at the end of the question is, yes, it's safe. 2, take it out when you're gonna heat it. 3, don't let the kids keep reusing it and chew on the edge of it there.
Okay. Can a sinus infection cause a toothache? It's pretty direct. It can?
Yes. Now that's an easy one. You've got lots of sinuses. You've got 2 sinuses up here called the frontal sinus. You got 2 sinuses right there called the maxillary sinus. And you got 2 big old ones back here that back behind the ear you don't even want to worry about. So maxillary sinusitis is often a cause of pain in the eye, because the top of the sinus is under the eye, and these teeth go right up into the end of the sinus. And so various types of sinus infection can cause the upper teeth underneath that sinus to hurt. That's an easy one.
All right, now I want to ask my question.
All right.
Actually, every time I eat an apple around somebody, and they're not used to me, and they sit there and they watch, they look and they say, you just ate the entire apple.
Oh, I eat the core.
Do you?
Oh yeah, I've been eating the core for 40 years, and the reason for that eating the core is a good one. One, we as Americans...
Listen up, Sam. Pay close attention.
We as Americans...
We have to make sure she pays attention.
We as Americans do not get enough fiber. The amount of fiber you're supposed to have in your diet is 35 grams per day. If you have 35 grams per day, you generally will have stool in the amount of 400 or 500 grams per day. The average American has about 100 grams of stool per day. The normal bowel function is every time your stomach fills, your colon's supposed to empty. That's called the gastrocolic reflex. So and we've talked about this before. So the natural frequency for stool is 3 a day after a meal. So when you eat the apple core, you are adding a tremendous amount of fiber to your diet that you're not going to get from going to the restaurant or the fast food place, because most of the foods are low in fiber. Now, the one thing that people used to say is Laetril, which was made in Mexico, it used to be given from Mexico, was made out of apple pits, and that's BS, and the apple pits are going to go right through you and add to your fiber, and it's very healthy to eat the core. And you didn't know that I eat the apple core, and I used to be known in the hospital as the doctor who eats the apple core, but you asked the right guy.
I do. I just eat the apple core. I just do.
I do too.
Good. Thank you. I get a lot of comments about that when I'm around
Sure,
people.
I do too. I did it forever. People are so used to it now, they don't comment on it anymore.
Maybe I'll just have to start drinking Tab also. I'll have to go to Tab. Dr. Whaley, before we close, because our all-star panelists showed up, because right after this segment we're going to have our all-star panel, political panel. Anything, because you usually bring something, or is there anything you wanted to discuss this morning before we leave that you wanted to highlight before we go?
No, I think I'll go back to John McCain. I pray with my patients, and I say that you should pray that the treatments that we have outlined, that your cancer is sensitive to the treatments that we have outlined for you, and that the work that I'm doing by writing these orders, God's directing my pen. So I think if people want to really think about John McCain, and we have a large Christian base of people in this community up here, they should pray that John McCain's disease is sensitive to the treatments that he is given, and that the Lord guides and directs the therapy for him in the way that the Lord wants it to go. And if the Lord wants John McCain to be in the Senate to cast votes, make it happen. And I'd rather do that than talk about the fact that marijuana leads to depression in kids or something like that.
Okay, I think that's a great ending note. I appreciate it, and actually I appreciate you coming on this morning and explaining that to us in a way that we've yet to hear outside of this morning, and I appreciate that very much. I'm your host, BKP. We want to thank Dr. Whaley in our segment Ask the Doc. Especially want to thank the Georgia Cancer Specialist, and we're at Sycamore Crossing. And just so you know, Budweiser did show up on the way. The noise in the background, a Budweiser truck made it by.
And no train whistle yet.
Yeah, well, no, we did.
Oh, you did?
Yeah, earlier this morning. We had train.
You weren't on TV though.
Yeah, no, we were on train.
Okay.
Yeah, train whistle. Budweiser is here. That means there's plenty of it's a beautiful morning in Blue Ridge, Georgia. Come visit us. Dr. Whaley, thank you very much.
Got it.
Our all-star political panel is next, right after these messages. Circuit World, brand name merchandise at unbelievably low prices. Furniture, appliances, and electronics. Circuit World is locally owned and operated, serving the tri-state area. Circuit World has highly trained professionals to help. Visit your hometown Circuit World today. 3 locations in Georgia: Ellijay, Blue Ridge, and Blairsville, Franklin, and Murphy, North Carolina. No credit checks, so let Circuit World deliver to you today.
North Georgia Diamond is your source for diamonds. Come on in to view the area's largest selection of fine jewelry at North Georgia Diamond. All repairs and designs are done on site by our jewelers. And North Georgia Diamond has the lowest prices on loose diamonds. You can also sell your gold, silver, and coins at North Georgia Diamond between Walmart and Lowe's in East Ellijay. Locally owned by Bill and Allison Craig, North Georgia Diamond is your source for diamonds in North Georgia.
Hello, my name is Chad Watkins. I'm the manager at Larry's Body Shop. We are a family-owned and operated business and have been serving the North Georgia area since 1978. We are located at 1216 Progress Road in Ellijay, Georgia. Our shop specializes in collision repair, and we work with all major insurance companies. Larry's Body Shop is ICAR Gold, the highest role of training recognized by the collision repair industry. It is estimated that only 10% of collision shops meet these standards. Our shop consists of state-of-the-art equipment such as laser measurement system, down-drive spray booth, spot and MIG welding equipment. All of our paints are mixed on site so that we can guarantee your paint to match every time. I know that having an accident can be a stressful event. We take pride in making sure our customers are satisfied with the repair of their vehicles. Our waiting area is clean and comfortable with free Wi-Fi and refreshing beverages. So if you're in an accident, stop by and see us at Larry's Body Shop.
Hi, I'm Rhonda the Mattress Lady, and this is my husband Gary, owners of Mattress Overstocked in Ella next to Walmart.
And we want to earn your business. From the time you walk in our door to the time we deliver your new mattress to your door, you will see the difference. Our select